Hello, so I'm Nicole Walters, and I looked at osteoarthritis and stress. So prior to this research, I didn't really know much about osteoarthritis. I knew there was arthritis, and I knew, or I've known people who've had it, and I've seen like the nasty effects it can have on people and like how it can affect their joints. But I didn't know much about it, and I didn't know how stress impacts it. So I was interested to learn more. And while learning more, basically, osteoarthritis, the onset is caused by physical damage to a joint's articular cartilage through overuse or injury. So, typically, the joints that are affected are weight bearing joints, such as the hip or the knee. And with the overuse or injury, this can cause the joint to break down and result in the experience of pain and inflammation in the affected area. So if you look over here, this is a joint with osteoarthritis. It's definitely different than rheumatoid arthritis, which I don't know if I said that properly, but there's definitely some inflammation and the look of just not as much cartilage as what a healthy joint would have. So with the stats, there's 26.9 million Americans that have osteoarthritis, according to Taylor 2018. And out of those people, more often women have it than men. And as well, older people typically have it from ages 50 and up than someone who is in their 20s or younger. So there are some people who do have it who are young, and that would be athletes, but typically it's people who are older. And as well, so stress in the progression of osteoarthritis. So osteoarthritis can decrease the mobility to accomplish everyday activities in the people with it. So this could then create pressure to perform these everyday activities, and that could create stress as well. It could create avoidance of activities, and then that could result in psychological distress or depression, which was found in Zatra and Smith's study. As well, in a meta-analysis conducted by Hala et al., they found that 2 out of 4 high-quality studies in the meta-analysis found that there was an association between psychological distress and avoidance of activities. So based on the limited studies that are out there, because there was only 4 and the 2 did have an association while the 2 others didn't necessarily have an association. So based on these limited studies, some people could avoid everyday activities because of their osteoarthritis and like the pain that they feel from it, and because of this avoidance, experience psychological distress. There needs to be more research done to get a more conclusive answer on this inconsistent association, but for now there could be a possible link between them. As well, in a study by Brown et al. In 2013, he found that anxiety was found to be higher in patients with osteoarthritis than pain-free and healthy individuals. So looking at this study deeper, it was found that individuals with osteoarthritis experience greater pain, catastrophizing, and clinical pain than individuals without osteoarthritis. So, such as healthy individuals that do not deal with pain. So, as well, through painful pulses of a carbon dioxide laser on the skin, it was found that there was a trend in osteoarthritis participants having more activity in the insula cortex than pain-free participants. So the insula cortex specifically is where pain and tenderness signals are present, and you can see in this diagram of the brain, it is deeper within the brain. So, osteoarthritis patients may anticipate the pain of an activity to a small degree, according to this finding. As well, there was a finding from Brown that reduced neuroprocessing during pain anticipation in a left lateral frontal parietal cluster was present. So, this could mean people with osteoarthritis are more likely to cope less well to pain than pain-free individuals. And with that being said, stress can make the perception of pain feel worse even if the pain is not physically worse. That could be the possibility as to why these individuals are more likely to cope less well. So with there being the relationship between stress and osteoarthritis, there should be some stress management techniques that are used for people who have osteoarthritis. So some types of techniques that were really looked into were relaxation skills. So Lee et al. Really looked at mindfulness, and they found that mindfulness decreases the intensity of pain on stress in individuals with knee osteoarthritis as well. Depression was found to decrease, self-advocacy increased, as well as quality of life and stress decreased. And they were all directly associated with mindfulness. As well, guided imagery was looked at for a relaxation skill. This was helpful. It was done by Keefe and Somers. They trained elderly in guided imagery, and these individuals experienced significant improvements in pain, tension, physical function, and mood compared to the control group. Lastly, a meta-analysis done by Zhang et al. Looked at relaxation. It didn't specify exactly how these relaxation techniques were administered, but they did find that relaxation techniques significantly improve the participants' ability to cope with pain and increase self-efficacy. So I bolded self-efficacy because self-efficacy seems to be an important component in stress management for people with osteoarthritis. So self-efficacy is the belief that one can successfully take action to produce a desired outcome. So improvements in self-efficacy could be very beneficial for individuals with osteoarthritis and could make different types of stress management techniques more effective, potentially. So according to Taylor in 2018, improving one's sense of self-efficacy could alleviate stress and pain. And like I said, stress management techniques like mindfulness could be more beneficial because of the role of self-efficacy. And lastly, anticipating that one can cope with the pain through self-efficacy could seize the reduction of neural processing found in the left lateral frontal parietal cluster. It's not saying that the neural processing will just completely be alleviated, but it could, with self-efficacy could counteract the reduction of neural processing, and so an individual won't feel as much pain because they are not perceiving the pain as badly as they would if self-efficacy wasn't there. So another type of category of stress management that was looked into according to studies was behavioral activation. So behavioral activation is graded activity, increasing physical activity, increasing enjoyable activity, and reduce avoidance. So based on the research done by Harris et al. In 2016, a qualitative study of women with osteoarthritis used physical activity to cope with pain. So they found that this physical activity was really helpful with their pain and how to manage it, but few women use this technique specifically for stress. But due to the nature of physical activity and what is known about it, the physical activity may have inadvertently helped with stress, even if those individuals were not completely aware of it. And lastly, another stress management technique that was looked into and that seemed to be very effective was positive psychological interventions. So cognitive restructuring is one learning to challenge one's negative thoughts and maladaptive beliefs about themselves by looking at the positives in their lives. So positive psychological interventions can be a part of cognitive restructuring by looking at the positives in one's life. So based on the research done by Hausman et al. In 2017, patients with knee and hip osteoarthritis received 6 weeks of education in positive psychology. So they worked on gratitude and kindness, and with gratitude and kindness, they significantly reduced osteoarthritis symptom severity and improved measures of well-being. And after 6 months, individuals still had pain-related and psychological benefits from these interventions, which shows that this type of stress management technique was very helpful in the individuals with osteoarthritis. And these are my references.